What are some of the outcomes of some of these genetic problems? You don't make enough cells because they don't undergo mitotic division. And so what happens to you is instead of having 1,000 cells, you only have 100. Or in the case of red cells, instead of having trillions and trillions of cells, you only have trillions of cells. But that's called anemia. It's one of the major types of anemia, is the inability to make enough cells. Why would anyone do that to a bone marrow? Because many of the chemotherapeutic drugs, the traditional cytoreductive drugs that people use, were aimed at preventing cells to undergo mitosis. Why did they want to do that? They wanted to do that because it's a good way to kill cells. If I prevent you from undergoing mitosis, you don't grow in number, you don't grow in function because you're not there, and you can create a pretty good kill zone around them. So you have something called an aplastic anemia or a hypoplastic anemia. It's very common in people who have classically described cytoreductive drugs. Everything goes down. You know, it's just one of those teensy-weensy side effects that we kind of tell you about, but not entirely. Okay, what else can you do with these mutations? You can cause these cells to undergo mitosis but not work. Well, how do you do that? You can just force them not to do something. But for you today, I think one of the bigger issues with the changes that mutations can give you is you have a repair mechanism in your cells. It's a fairly complex one, so I'm only going to talk about one of the items. But one of the items that occurs in your cell as it looks at and does quality control on your genes here is if it sees one that's abnormal, it can fix it. It can repair itself on its own. Or it can suppress the cell that's got the damage and somehow control the cell to the point where the cell dies rather than continue to live and proliferate. P53 is an example of a suppressive process. If you damage P53, then the cell that's damaged is allowed to continue.